Okay. The patient was brought to the emergency room by his spouse after engaging in suicidal behavior by attempting to slit his wrists. The patient was in a depressed state, which was obvious by his pleas to let him die and not intervene medically. After speaking to his spouse more in depth, it was noticed that the patient goes through varying stages of extreme depression, hyperactivity, abnormal sleeping habits, either too much or too little, and mania episodes. The patient was moved to the psychiatric ward for further evaluation. Following a 2-week stay in the psych ward, an obvious diagnosis of bipolar disorder was concluded. The diagnosis of bipolar disorder was reached when the patient presented various abnormalities cognitively, behaviorally, and psychologically. Some of these symptoms include delusions, hyperactivity, uncontrollable thoughts, aggression, extreme sadness, and irritability. Medical treatment was given to the patient, which included mood stabilizers and antipsychotics to control delusions. Upon conclusion of the 2-week stay, the patient seemed to have been more stable in his actions and behavior. It has been recommended that he see a psychiatrist for further evaluation and treatment modification if needed. The patient will have to undergo therapy sessions, both for cognitive and behavior issues. The treatment plan will always be monitored throughout the patient's lifetime, and medication will be prescribed or adjusted as needed. Side effects to medication and/or improvement or decline of the condition will determine the treatment options. No cure for bipolar disorder has been discovered, but symptoms can be controlled with proper treatment and observation.